And they're watching. Today, you're going to see a lot of people. We're wearing red. You're going to see people wearing red all around town today. It is all to raise awareness for women's heart health. Joining us this morning to help explain, Dr. Brett Scher from Sharp Reese Steely Medical Center. Dr. Scher, thank you for being here.
Thank you very much. It's a pleasure to be here.
You know, sometimes you got to have a day like this. It just gets people talking. It gets people talking about, from what I understand, is the #1 killer for women, heart disease.
Right, and that's surprising to a lot of people, and that's a big part of why this day is here. When you say heart disease is the #1 killer in men, it doesn't surprise a lot of people. But when you say it for women, it really catches people off guard, because diseases that are more unique to women, like breast cancer and ovarian cancer, get a lot of attention, and for good reason. But when you think of the fact that 1 in 3 women die of heart disease, it's important to put that information out there, especially since there's so much that can be done to prevent it.
What can you do to prevent it? When we have these conversations today, people wearing red, you talk to your moms, you talk to your daughters. Who do you talk to? What do you say?
You talk to everybody, because there's good evidence out there that up to 80% of first heart attacks are preventable with healthy lifestyle habits. Yeah, 80%. It's pretty strong stuff. And it all comes down to getting regular exercise, physically active, eating healthy, not smoking, not being obese, and then I like to throw in there stress management and having strong social connections. All of these lifestyle habits have been shown to reduce your risk of dying of a heart attack, but you're not going to prioritize it unless you realize the importance to it.
So our heart is like in here, you can't see it, but then you don't really see the symptoms, or do you?
Yeah, you don't see symptoms early because it's a lifetime disease. It's not like it just shows up all of a sudden one day. But when you do get the symptoms, you need to be aware of it. Also, one of the problems, or not one of the problems, but one of the differences between men and women. The classic symptoms is the weight on the chest, and the elephant sitting on your chest. But women tend to have what we call atypical symptoms. Meaning it could just be neck pain, or jaw pain, or arm pain, or nausea. And they may not recognize it as a heart attack. And that's why studies show that women tend to show up to the emergency room later than a man would.
Yeah, because all those symptoms that you're just talking about right now, it sounds like I experience that on a daily basis. So when do you know that it's time to go get some help, go get checked out? How early do you go to the doctor for this? Yeah,
if you're feeling symptoms like that and you're not sure what they are, then you should definitely go get it checked out and see your doctor. Now, before you ever have symptoms, you should also see your doctor to see what you can do to lower your risk for heart disease. And there's a big campaign out there about knowing your numbers, your blood pressure, your cholesterol. But it goes way beyond that. It's not just about your numbers. It's also about how you live your life and your healthy lifestyle habits.
So if there's one takeaway, doctor, that people that are watching today, yes, we're all wearing red, yes, we're talking about it, but if there was one takeaway you want people to know today, what would that be?
Yeah, it's that heart disease is the #1 killer for men and women, and it is entirely preventable with healthy lifestyle habits.
So take care of your heart. Take care of your heart. So if you're getting ready this morning, friends, everybody has something red in their closet. Grab it, wear it for your support for Go Red for Women. That's what we're seeing today, right?
Right.
I love it. Thank you for being here.
My pleasure.
Even the red, we got Martinez. He's wearing red too.